Upper cervical care is radically different from the health care that, a lot of us were raised with, which focuses usually on crisis management. It focuses on symptoms or going to the doctor when you have pain. It's a reliance on drugs and surgery. So it's not just different from that, it's also different from general chiropractic care. And that's something that we need to talk about just a little bit, because an upper cervical doctor, after receiving their general chiropractic degree, goes on to postdoctorate certification specific to upper cervical care. And so that's something that we need to discuss.
It's the difference between if you ask directions to someplace and they say, head down here and turn left at the tree. It's the difference between that and you go to MapQuest and you have exactly the right information on how to get there. The information that we give as upper cervical doctors to the body to allow it to heal is so much more specific and so much more precise. Because of that, the body is able to take that information and run with it. So people get well quickly and stay well.
Upper cervical is based upon the premise that when the atlas dislodges and it can't pull itself back in, it can create the vast array of problems. And rather than focusing on adjusting where the pain is located, we focus on getting back to where the epicenter is.
We will take a couple of x-rays that are different than you'll find in a medical office and even in a chiropractic office. And we'll get measurements on these down to 1/4 of a degree, trying to determine exactly the alignment and malposition of these two top bones in the neck.
Rather than pushing that hip back into alignment, only to have it pull back in the old position because of the tightened muscles, we found by making the upper correction in the atlas area, the upper cervical correction, we can allow the muscles to reposition and restructure the spine. And so this is why we don't make corrections all the way down the spine. We can get that upper neck adjustment to do that for us.
What we want to see with patients is not adjust them 5,000 times over the life of their care. Our goal is to make a specific correction, unlock the vertebra, put it back in its normal range of motion, and keep it there for as long as possible.
You can adjust a low back problem all that you want, but if that weight of the head is still off center, the minute they're standing up in a gravitational field, you're going to go back into the same pattern. It's not to say that all chiropractic doesn't work, it certainly does, but I want to clear from above down and inside out. I want to make sure it's on 100%.
What we do is safe and gentle and does not hurt people.